Hi, I'm Dr. Anusha GP, Consultant Fertility Specialist at Cloud9 Hospital, Tanisandra, Bangalore. OHSS stands for Ovarian Hyperstimulation Syndrome. It is an iatrogenic complication of IVF seen after ovarian stimulation and egg retrieval, which results in cystic enlargement of the ovaries and shift of the fluid from intravascular compartment to third space because of increased capillary permeability, which basically means there is accumulation of the fluid in the pelvis and in the abdomen. So what are the risk factors for OHSS? Firstly, a known case of PCOS, that is known case of polycystic ovarian syndrome, or she has a high ovarian volume or high AMH, or if she is a lean patient, or she has had history of OHSS in her previous IVF cycle, or during the stimulation of IVF, she has rapidly increasing estrogen levels, especially more than 3000 picograms per ml. So OHSS can be either mild, moderate or severe. Mild OHSS comprises around 20% of the IVF cycle, where usually the patient just has mild abdominal pain and bloating sensation. Moderate comprises around 3 to 6% of the IVF cycles. Here the patient has moderate degree of pain associated with nausea and vomiting, and ultrasonography we can see a certain amount of ascites, that is fluid in their pelvis, and the ovarian size is enlarged. Severe OHSS, around 1 to 2% of these IVF cycles comprise of severe OHSS, where the patient has severe symptoms like severe abdominal pain, bloating, increased abdominal girth, then reduced urine output, difficulty in breathing, and on blood investigations we find altered parameters, and on ultrasonography we see ascites as well. So how can we prevent OHSS? So if the above mentioned risk factors are there, and when we start the stimulation for the patient, start with low-dose gonadotropins or use mild stimulation protocols. We can advise for high protein diet from the beginning of the stimulation, where we can advise asking them to consume 2 to 3 egg whites per day, or can prescribe them any form of protein powder, and advise for plenty of oral fluids, at least 2 to 3 liters of water every day. Avoid any form of heavy exercises or activities. Start also metformin medication from the beginning of the stimulation, which controls OHSS to a certain extent. Then if possible, opt for only agonist trigger for final maturation of the oocyte instead of HCG trigger. Then once the egg retrieval is done, certain drugs can be prescribed to suppress the ovaries, like dopamine agonists like cabergoline, letrozole, or antagonist injections. So they reduce the estrogen levels rapidly and prevent the risk of OHSS. And in high-risk patients, we can give IV colloidal solutions like albumin or starch, and advise the patient to continue high-protein diet and plenty of oral fluids, and advise them to ambulate as much as possible. And in case of extreme symptoms, severe symptoms as mentioned, they need to report to the hospital immediately.